be like this. Okay, so this is kind of loose. All right, relax. Good. The thrust is going to be from here. Okay, that's kind of what makes this happen. And we just got to get it all wound up so it's in the right place. But this is kind of the biggest input. All right. So the whole goal is to just bring the barrier to the second rib. And so I'm going to do that by using kind of a flat hand and really making my thenar eminence fat. And I'm going to get just medial to his rib angle. Okay, and that's important because we're doing a distraction of the costotransverse joint. And so if you're out on the rib angle, that's where you're going to break a rib, number one. And you want to be medial to it so you can get that distraction to move the rib anterior to the transverse process. It's also more comfortable because there's more paraspinals and that kind of thing there. All right? So I'm going to reach around, I'm going to stick this on his second rib, and then I'm going to drag down on the skin to tighten things up. So, that's not tender, huh? Okay. So, just like I said, I got my thenar eminence on there. Now as I roll them back, I'm going to drag down, okay? And I'm really making my thenar eminence fat here. And I got this hand right over the coracoid, okay? I got my sternum right over my target, almost, okay? And when I thrust, it's going to be straight down.
So is this on the TP?
Nope, it's on the rib.
It's on the
Just
actual rib.
lateral to the TP.
Okay.
Yep.
Okay.
Medial to the rib angle, lateral to the TP. All right? If you're right on the TP, you're just going to compress the rib into the TP.
Okay.
And you'll get some thoracic rotation, which is not bad. But if we're trying to gap that rib, you got to be off of it.
And just to clarify one more time, so the thenar is actually on the rib, it's not like in the gully.
Right.
Okay.
Right. I mean, the whole deal to make this work is to bring all your forces right there on the rib. Because otherwise it just gets dispersed everywhere. I mean, this is pretty wobbly technique, right? So you really need to just bring it to that spot. Harder tables better.
And this applies to the upper ribs.
Well, this is 2, so I'm pretty upper.
But
There's only one more up.
you can't go. Can you apply this to other ribs?
Yes. Yeah. I would probably do something different with his arms, which I can show you, but I don't think there's another technique in this class. But yeah, you can do this all the way down until they just get springy, you know. All right, so there's rib angle. I'm going to be a little medial to it. I'm going to do this in real time this time. So I'm going to drag down, bring him over, and okay. So that's as long as I'm going to keep him there. Okay? To show you again. And I don't know if you noticed, but when I did that, I used his momentum with my thrust. So I brought him over, he's still moving, and then I hit it. All right? I don't hang out there, wiggle around, and like, everything gets dispersed if you do that. But a lot of things happen in that moment. You know, I'm dragging down, I'm pronating, I could be even doing like some little side bending of him, some rotation, all this stuff. Like I said, you have to feel like a crisp barrier there. You have to feel that. If you don't feel it, it's just like, you know, bleh, bleh. Right? It's got to be like, everything's got to be like, my whole being is like right at that spot. So this is all these little things come together.
So the thrust is not with your hand on the shoulder area, it's more with your
It's probably 20% here,
okay.
and then like, you know, 50% here, and then another percent here.